BSI mycene is safe. My nature of illness is difficulty breathing. I will request another ALS ambulance, and I will not consider C-spine at this moment. So I see that my patient is conscious and she is looking at me, so I'm going to give her an A on the APU scale. And so, hi ma'am, my name is Madison. Nice to meet you. I'm from the ambulance. Can you tell me why you called me today?
Hi, I am having trouble breathing.
Trouble breathing?
Yeah.
Okay, so her airway is open, and I know that because she's speaking. I will give her 15 liters of 100% oxygen via non-rebreather mask. So I don't see that she's bleeding, so I don't have to control any of that. Can I check your pulse, sweetheart?
Sure.
Thank you. Okay, so her pulse is strong and regular, and her condition, temperature, and color are pale, normal temperature, and she's dry. So I'm gonna make her a high priority patient. Okay, can you describe the onset for me?
I was running around my neighborhood, jogging, and as I got close to home, I felt a tightness in my chest.
Tightness in your chest, okay. Did it start gradually or out of the blue?
It was very quick.
Very quick, okay. Can you tell me if anything makes it better, anything makes it worse, like sitting up or...
Staying still like this is helping.
Standing still like that?
I can't really move.
Not move? Okay. Can you describe the tightness for me? Like, is it really painful or is it just uncomfortable?
It's a squeezing.
A
squeezing?
squeezing?
Squeezing.
Okay, okay. So can you tell me if it spreads anywhere, like in your back, shoulders, anywhere?
Really right here in my chest cavity.
Just in your chest cavity? Okay. So on a scale of 1 to 10, with 1 being I can breathe and 10 being I can't breathe at all, this is terrible, what would you rate it?
About a 4 or 5.
4 or 5? Okay. And how long did you say this has been happening?
20 minutes maybe?
About 20 minutes?
Yeah.
Okay. So I'm asking a few more questions. Do you have any allergies to anything?
I do. I have seasonal allergies.
Seasonal, okay.
And penicillin.
Penicillin, okay. Do you take any medications for anything?
I have a Buterol.
Buterol?
The inhaler.
Inhaler, okay. So do you have any past experiences with asthma or anything similar?
In the past 6 months, I've had about 3 or 4 flare-ups.
3 or 4 flare-ups? Okay. And when was the last time you ate and what was it?
About an hour and a half ago, and I had some pasta.
And pasta about an hour ago? Is that what you said?
Hour and a half.
An hour and a half ago. Okay. Just had to make sure. What were you saying you were doing? Just so I can be triple clear.
I was running around the neighborhood.
Running around the neighborhood? Okay. So I'm going to ask 2 more questions and then I'm going to check your lungs if that's okay.
Okay.
Okay, so do you smoke any tobacco products like cigarettes?
No.
No? And since you have seasonal allergies, were you running around like pollen or ragweeds or anything?
Not that
I
saw.
Not that you saw? Okay, so I'm going to go ahead and check your lungs and your oxygen level.
Okay.
So, 1 deep breath. Okay. Another. Okay. Can you give yourself a big hug? Okay, 1 deep breath. Okay. Okay. Okay, last one. Okay, I do hear some wheezing. So, I'm also going to check your oxygen levels. So let me just put that on there.
Okay.
Okay. Okay, so your oxygen level is about 94%. Okay, so I'm just going to take some baseline vitals.
Okay.
Nothing major, just like your blood pressure. So let me check your pulse first, actually. Okay, so 98 beats per minute, and your respiratory rate is 22 breaths per minute, and it's also slightly labored. Okay, let me just put your, my blood pressure cuff on you.
Okay.
Okay. Okay. So your blood pressure is about 112/74. So my field impression is she's having an asthma attack. I am going to intervene by helping her without her albuterol inhaler if she has it. My reassessment is going to include redoing the primary assessment, retaking vitals, assessing the chief complaint, and giving her another puff of her inhaler if it doesn't help the first time. And then the report that I'm going to give is, this is my patient. She's a 33-year-old female. Her allergies are penicillin and seasonal allergies. Her medication is albuterol for asthma. She has had about 3 or 4 flare-ups in the past 6 months. Her last oral intake was pasta about an hour and a half ago, and she was jogging for about 20 minutes and it started to flare up.